Hey guys, it's Derek Z. This video is going to be about a painful shoulder that is coming from a shoulder that is either too loose or too mobile. But at the end of the day, it's a hypermobile shoulder. A painful hypermobile shoulder usually presents in a typical pattern. So they usually have pain at end ranges of the range of motion. So for the shoulder, the range of motion for the shoulder is full flexion, that's this way, and then bringing it out to the side, abduction, external rotation, either out on neutral or out on 90-90 positions, internal rotation, or internal rotation this way, crossing the arm, that's horizontal adduction, and then bringing the arm away, which is horizontal abduction. So with resistive testing, when I test the patient in the clinic, they usually have pain with the shoulder when I'm testing you in 90-90 positions, or they have pain at end ranges, or both of them, where they have pain at end ranges and they have pain with resistive testing in 90-90 positions. Resisted testing in 90-90 positions is this position here. You're at 90 degrees of abduction and 90 degrees of elbow flexion. So you're either testing internal rotation or external rotation in the clinic to kind of provoke pain, to give me a general idea of how stable or unstable their shoulder is. In the clinic, I usually do resisted testing for the patient just to give me a general idea of what I need to do for them. But since I'm doing this video for you guys, I'll show you a way of how you do this at home. So you still need to bring the arm up. Over here, I have a rack, so I'm gonna do this with this pillar here. At home, you can do this at the edge of a door or the door frame or near like the handrail of a stairwell. But either way, you're just pushing yourself into internal rotation at the 90-90 position. So you get the arm in this position, get the hand here, and you're pushing it forward. So it looks like I'm not doing a whole lot, but I'm actually trying to do this. So I'm trying to elicit pain is essentially what you're trying to do if you have a hypermobile shoulder. So if this feels uncomfortable, you're pushing down, or hurts a little bit, for me that would be a positive test. All right, so the next one would be external rotation this way. So again, I'm gonna use this right over here, and I'm just gonna come this way, and I'm just gonna push backward into external rotation. So in reality, I'm trying to do this, but it's an isometric testing, and also just gives me an idea of what the shoulder is doing. So just to review, if you have pain with end ranges of active range of motion, an active range of motion of the shoulder is full flexion, so overhead, abduction, bringing it out to the side. So external rotation, internal rotation, horizontal adduction or horizontal abduction. Any pain at end ranges of any of those motion would be positive for me to give me an idea of whether this might be a hypermobile shoulder or not. In addition, positive tests with resistive testing in the 90-90 position for internal rotation and external rotation. So if those two are positive for you, then these exercises are something that may be beneficial for you to do at home. There's gonna be some exercises to help a painful shoulder. So if you have a history of a dislocation in your shoulder, or if you might have likely had a small tear in your labrum in the shoulder, these exercises are for you. If you're somebody that's just very loose or very mobile, that's very flexible in the shoulder, and you're having pain from that, these are exercises that are also going to be helpful for you. The first three exercises is in your stomach. So these are prone T's, prone Y's, and prone I's. These are all exercises that are done in the position of prone, meaning laying on your stomach. These are all exercises that requires you to stabilize your shoulder blade. So when you're doing these exercises, you're face down. Prone I's is the easiest of them all, and then progresses to the next level, which is a prone T, and then from there it becomes a prone Y, which is the hardest one out of all three of them. So to start off on the easiest one, prone I, you're laying face down, palms facing down, or if it's too hard, you can go palm up,
But either way, what you're trying to do is, before you do anything, you're squeezing your shoulder blades. You're trying to bring one shoulder blade to the opposite hip, and same thing with the other shoulder blade. So you're kind of creating like an X on your back. So my right shoulder blade, I'm bringing them down and to the opposite hip. Same thing with my left shoulder blade. I'm bringing them in and down to the right hip, holding that position. I'm going to bring these up, and then I usually have my people hold it for about 10 seconds, and then I'm going to bring them down. Remember, when you're bringing them down, the shoulder blades are still squeezed. They're not relaxed. So when the shoulder blade is relaxed, you can see the front of my shoulders touching the table. When they're engaged, they are away from the table. So there should be a gap there when you're doing this. 10-second holds, 10 times. Progressing to prone T's. Prone T's are out to the side. Same thing, you want to squeeze the shoulder blades, bring them to the opposite hip. So in and down, hold that, and then bringing that out with the elbow straight. Thumbs are usually facing up. If that's too hard, then you can go palms facing down to start off with first. But this is the most ideal position. From there, that's also 10 seconds, and you do that 10 times. The next one with prone with prone Y, you bring the both arms up, elbows are straight, still shoulder blades are engaged, and then you lift that up. Same thing, 10 of them with a 10-second hold. The thumbs are pointing upward in this position, or you can have this down, but you definitely get more bang for your buck when your thumb is up.
The next exercise is a banded landmine. So when you do this, you just need a resisting band and set up to something that can stabilize the band. So at home when you're doing this, your resistant band, just tie a knot, throw it on the other end of a door and put it on the bottom. So the resistance it's anchored down near the bottom. So the exercise looks like this. Oh, also another thing, if you're having knee issues, because you need to kneel for this, you can put a towel or a pillow underneath, because when you're putting pressure on the knees, just to help desensitize it, if your knees are already a little sensitive to begin with. So trunk is upright when you're doing this. You're just punching up into the overhead position. The landmine is a nice exercise to help you strengthen into the overhead position. And a lot of times if you have a hypermobile shoulder, you're usually unstable up overhead. So that's why when we do resisted testing, we test in 90-90 positions, because it gets us close to the overhead position. The last exercise is what we call an armbar. So with this, you need a dumbbell. I have about a 10-pound weight that's right over here. You start on your back. So with this exercise, you basically take the arm, have it straight, take the dumbbell, and move it to the ceiling. So this is not the extra exercise. The exercise is taking your shoulder blades away from the ground and keeping that away. So you do this here, hold it here for about 10 seconds, and then you roll arm to your side, and same thing, holding it here again for about 10 seconds, maintaining that shoulder blade away from the body. When you come back to your back as you row, you maintain that space on the shoulder blade. Same thing, 10-second holds, making sure there's a space here and not here. So you want to do this again. This is rep number 2. You basically punch up, hold it there, and then as you hold it there, you want to rotate off to your side, continue to hold that shoulder blade away, just maintaining a good position, and then you roll back, not letting the shoulder blade fall back onto the ground. And this is the relaxed position. Plank taps is the next one. So you're in a high plank position. I like plank taps because it's a weight-bearing exercise for the shoulder, which actually helps you centralize the head of the humerus back into the joint, especially for those of you who are hypermobile. That becomes an issue as you're starting to move the shoulder in different positions, because a lot of times the humeral head can be sliding on and off to different areas, especially if you have a history of dislocation in the past. So what you do with this exercise is you're in a high plank position. And all you're really doing is just bringing your opposite arms to the shoulder. Sorry, the opposite hand to the shoulder. I usually have people do this for time. So like a 30-second at a time and then 3 sets, or really it's whatever you can do. If at about 10 you start hurting, then 8 is where you would stop. Remember, when you're doing these exercises, there shouldn't really be a whole lot of pain, but maybe a little bit of discomfort. If there is a ton of pain that's enough to stop you from doing the exercise, you want to either change a couple things. There's only so many variables that you can modify. You can either change the number of reps that you do to the exercise. You can change the range of motion in which you do. You can decrease the range of motion. You can decrease the resistance on the exercise, or you can modify the technique somehow in a way where you're still doing the exercise, but you're not having as much pain. That kind of falls with changing the range of motion. Give these a try. Let me know how they go. If you have any questions, please leave them in the comment section below, and I'll see you guys in the next video. Thanks for watching.